Dr. Jeff talks love, Dr. Jeff talks life, answers your questions, cuts through the strife. Sex and intimacy, real and true, evidence-based, made just for you.
Hello, welcome to Dr. Jeff Talks About Sex and Intimacy, where we explore the science, the body, and the human heart behind sexual wellness. I'm your host, Dr. Jeff Albaugh, and I'm so glad you're here. Today, you're joining us for episode 48, Breath, the Body, and Intimacy, Unlocking the Urogenital Diaphragm with Dr. David Luyando. Whether you're watching live or listening to the recording later, I want to thank you sincerely. I truly appreciate every single one of you out there. Your engagement, your curiosity, and your willingness to learn are what makes this whole podcast possible. You're what this is all about. So thank you so much for being here. So we are connected across so many platforms. We are on Facebook. We are on YouTube. We're on LinkedIn. We're on Kick. If you're joining us on X and want to submit questions, hop over to YouTube, LinkedIn, Facebook, or StreamYard, and you can interact with us directly. A quick favor, if you are a Facebook person, please follow us. The more people that follow us, the more we can do on Facebook. We really appreciate all of you who watch, follow, whatever you do with us, like us. Thank you so much. Also, visit the website. If you're looking for past episodes, there's 47 of them. Now there's 48. So you can watch all the past episodes at your leisure. You can pull up the calendar and see what's coming next. If you look on that website, you will find a lot of great information, all the amazing guests that have joined me and all the ones that are coming in the future through February. So please go to the website. We are where you are. We're in your car. We're working out with you. We're wherever you like your favorite streaming system is. We're on Spotify. We're on Amazon Music. We're on iHeartRadio and more. So take us with you when you're working out, when you're on your road trips. We'd love to join you on those. Please take us with you. The mission of the podcast is pretty simple if you haven't been here before. It is simply to empower and enlighten you with evidence-based, that scientific information that you need to improve your sexual health, to deepen your miraculous relationships so you can live this one beautiful, wholehearted life with more love. Who doesn't want more of that? Today, we're diving into a part of the body most people never think much about, but absolutely should: the urogenital diaphragm. This deep pelvic structure plays a powerful role in sexual function, intimacy, and emotional regulation, and even how we hold stress in our bodies. To help us unlock this hidden gateway, I'm joined by the brilliant Dr. David Luyando. He is a chiropractor whose work bridges structural alignment, breathwork, and integrative pelvic health. Dr. Luyando has a gift for helping people reconnect with their bodies in a grounded, accessible, and often, and I will tell you for sure, life-changing way. He is my chiropractor, my acupuncture, my Qigong guide, my healing guru, and he is awesome. We'll explore how breathing, pelvic awareness, and nervous system regulation can transform sexual wellness, deepen your intimacy, and open new pathways to pleasure and connection with others. So let's dive in. Let's talk a little bit about Dr. David Luyando, our chiropractor physician guest. He is a chiropractic physician. He does integrative body work, and he's known for his expertise in functional movement, pelvic alignment, breath-centered healing, Qigong, you name it, the integrative things, Dr. Luyando is right there in it. With advanced training in neuromuscular therapy, pelvic biomechanics, and the body-mind connection, Dr. Luyando helps patients understand how the spine, the diaphragm, the pelvic floor all work together to support whole body health and sexual function. He blends evidence-informed chiropractic care with therapeutic breathwork and movement practices, and you'll experience some of those today to help individuals restore balance, to reduce pain, and reconnect with their natural capacity for intimacy and pleasure, for healing. All of us have that healing power inside of us. And Dr. Luyando is brilliant at unlocking that healing. His compassionate, body-aware approach empowers patients to understand their anatomy, calm their nervous system, and to access great vitality and connection in their daily lives. I have personally seen the amazing results of what Dr. Luyando has been able to do. He has a wellness center out in Bartlett, and he is just absolutely amazing. And he's a dear friend and a beautiful human being. And I'm so excited to welcome my friend and colleague, Dr. David Luyando.
Dr. Jeff, thank you for that wonderful, wonderful introduction. You cannot say any better than what you just introduced it. Thank
Oh
you
no,
for,
it still doesn't say it all. You're even better than that. So I'm
thank you
so
for bringing me to the
excited.
wonderful esteem of excitement at this very moment. So thank you for each and all of us that are tuning in. I applaud you for this very segment that we're going to dive and get the best resource of information so you could be weaponized with the gift that you have within your power. And we want to focus this power, which is dunamis. Dunamis is in Greek. It means power. It's an explosion. It's an awareness. We want to wake up. We want to tap into our innate ability to have the power of dunamis. So whenever this gets so delicious, I want you to get excited to say dunamis, because dunamis is exactly what we need, power. And I want to define what is this power and how can we infuse this particular dunamis element in our work of life, in our quality of our health that we solely deserve. Starting off right now, I apologize. I was hoping to make it to my wellness out of Bartlett. Unfortunately, I got stuck with traffic. I do have a studio there as well. I had some PowerPoint I want to share with you. And unfortunately, we're going to do this freestyle. And I'm pretty much well rehearsed in terms of getting my information and convey the messages to excite you, each and all of you, as reference to this panel with
Nobody
breathing
can
and
do it
how.
better than you. Nobody can do it better than you. So I'm going to hand it over to you. It's all you now.
Thank you so much. Thank you so much. Okay, so I believe I have like 15 minutes to dive into the elements of corrective medicine, functional moment. So let's kick it off. I would like to say a little pop quiz. How how many days that you were able to survive with not eating? You got hunger, you got hunger, starvation, and then ultimately death. How many days would that be before we die with no nutrients in our physiology to sustain us? Some people will say 30 days, 40 days. I would say if you in good health, you could survive as much as 40 days into starvation before we kind of more or less transition to another plane. Okay, another question is, how many days that you would go without water, without drinking water? How many days can you survive with no water to be hydrated? That's another good question. The question is, I would say anyway, if you're not so healthy in terms of without no water, you got 3 days. 3 days, the most minimum at this very moment is 3 days. And what happened in 3 days, you start losing electrolytes. Some physiological hydration will take place, and also some hallucination, and also just shut down on your kidney because your urine will be darkened. It will be you wasting away there pretty much with no water intake whatsoever. If you're healthy, you may survive as much as 6, no more than 7 days before we actually transition. I have another question. How many days can you survive without sleep deprivation? How many days? I would say definitely based on World War II, young man in a foxhole, get digging in and anxiety, fear, concern. I would say 3 days. 3 days with sleep deprivation, you definitely die. And all these young folks back in World War II and Vietnam, they had anywhere between 3 days, no more than 4 days, and they'll die with sleep deprivation. And sleep, you need sleep, you need proper hygiene. This is what I'm bringing this about. You need nourishment, you need great hydration, you need to maintain quality of hydration, and also you need to have sleep hygiene as well to maintain some functional vitality. The question I have now, the next one is, how many minutes would it take with no oxygen whatsoever before you go into hypoxia? And hypoxia is low oxygen circulating to your body, and your function, your vital function will go into a death zone. How many minutes? Definitely, it will be under 4 minutes, which means we got it backwards, folks. We got it backwards. Yes, we need our nourishment. Yes, we need good sleeping. Yes, we need to be hydrated. Yes, we need to be around with good community of inspirational people in our life. But the most important thing, we need to eat oxygen. We need to get the quality of oxygen into the container of our lungs to bring the best power of that oxygen that will carry the blood will carry the oxygen to every vital organ of our body. With that said, when we have this wonderful oxygen, concentrated oxygen that is circulating throughout every vital organ of our body, we will have definitely health integrity. We could think better. We could process things better. We have better critical thinking. We need oxygen. We need to eat oxygen. I don't know about you, but I'm going to give you a couple of points on how to eat and focus and meditate the quality of oxygen you ought to receive. And we'll have like it's a 5 5 5 5. It's like 5 times 4, and I'll explain that very shortly. Now, my practice is definitely focused in the functionality of the body. We have 8 anatomical diaphragms. When you think about diaphragm, you think about the respiratory diaphragm. And when you think about respiratory diaphragm, that's a good thing. We have to have that. We have to have the diaphragm contraction and relaxation, because it also exercise our upper dorsal and also our abdomen. The diaphragm goes up and down during respiration and also aspiration, that you are definitely exercising with the diaphragm. A very powerful muscle, diaphragm, is going to really oscillate the physiological fluid, your blood, your lymphatic system, and also the central nervous system, which is your cerebral spinal fluid, to oscillate up to your brain. We need that particular diaphragm. It's a master diaphragm. With that said, there's our 8 anatomical diaphragm. The first one, the foundation, is definitely our feet. Our feet. The plantar fascia acts like a vibrational diaphragm. Every time you walk, every time you utilizing, I would say, toe raises, you are really, really activating these micro filament of muscle and support system that really oscillate the fluid, your physiological fluid, to different part of your body. You need to get into these type of exercises, especially toe raises, so you can really circulate your physiological fluid. The next diaphragm is definitely at the knee. You call it the general articulation of the knee, and this is the knee. That just like this is a compartment. It's a plateau, the knee, and it has a tibia and the fibula and the femur right on top of it. And this is a compartment. Every time you bend the knee and strengthen the knee, that's what we call supplication. You're supplicating into bending the knee. It's only one motion: bending backwards, bending forward. That's it. So the knee is also a diaphragmatic phenomena that keep the blood circulating every time. You need to squat. You need to walk. The next diaphragm, the urogenital diaphragm, that's the focus we're going to have today. But your urogenital diaphragm is definitely a dome. It's not this type of dome, but it's an inverted type of dome. and it has a lot of muscle, a lot of interrelated muscle, and also a lot of innovation of blood work, and also nervous system. And we'll talk that very shortly. But we need to activate them as well. We need to activate the circulation to the area, and we also have to have good oxygenation, and we have to activate the synapses, the nervous system that innovated to this wonderful area of the prostate. Another one is the diaphragm. We talked about that. We have another area which is the clavicular medium nerve. This is the shoulder girdle right here. You got the clavicle, the scapula, and you got the shoulder joint, and you have a lot of nerves and vascular that comes from the cervical spine to the brain and back and forth to innovate the functionality of your hands and your fingers. It's very important to reach and pull and stretch these nervous system, the nervous component, as well as the vascular component of the upper extremity. The other one is going to be the TMJ. That's another diaphragm. We're not going to talk about too much of that. We also have the hyoid. The hyoid is a little bone, like a horseshoe's bone that's between, it's right below the tongue, and you have this wonderful, powerful muscle in attachment to the hyoid, but also protects also the trachea as well. And then the ultimate one is going to be the supratentorial ligament. This is what keep our brain in a floating brain in the compartment of water. It maintain the brain exactly in that position, just like the kidney. The kidney has is a floating organ. So the brain is a floating organ, and the supratentorial ligament, anything above that is conscious awareness. Anything below that is subconscious awareness, just to give you a pointer. So let's talk about this breathing. Let's go back to the prostate. Excuse me. So the prostate, you already know the anatomy, the physiology, the nervous system. Hopefully, you need to integrate yourself with these type of languages, the type of language that you need to associate with you with these type of wonderful attachment with nerve and capillaries and all those filament of muscle that create the dome. Folks, we need to strengthen those dome. We need to strengthen the urogenital area. And one area, you need to get into the squatted position. You need to get into this yoga position. You need to get into a Tai Chi, or you need to get into meditative Qigong. Qigong literally means to build up your energy, to be cultivated, to build up your energy. And what kind of energy are we talking about? We're talking about the energy of your breathing. And the breathing. So you want to, activate these type of muscle filament and continue to activate the nerve endings and the vascular to enrich the area desirable for you, for your vitality. You want to do, one area you want to get into and exercises. Just stand up and find your center of gravity. We're going to go through this very simple center of gravity. Folks, when you're in the center of gravity, two fingers below your umbilicus, you call that the dantian. The dantian. This is where your human spirit is located. This is where your vagal nerve, which is your pure, innovative, intuitive. Your human spirit is right there in that the dantian. You got to really honor that. You got to stand in a position that you want to seek and protect and be in a center of gravity. You want to tweak your body in such a way, booty down a little bit, open your knees a little bit, your feet got to be parallel to each other, your feet. So when you put your feet planted, shoulder width apart, and when you slightly open your knees away from each other, you're already strengthening the dome, the fine filament of the urogenital diaphragm. So when you actually stabilize in this and then bring your lordosis, not arching like this, but really tuck it in. All this tuck in. When you tuck in, you are lifting the dome of the urogenital diaphragm into these vital organs, prostate, bladder, and the surrounding structure of that dome. Second is make sure you keep your shoulder upright and slightly back. Your tongue. Place your tongue behind your upper teeth. I want to tell you more about that. Your tongue behind your upper teeth. You want to breathe in through your nose and out through your mouth. I'm going to give you some exercise with this. In through your nose and out through your mouth. And then lastly, make sure that your head is like a plumb line, or it's a plump line, lifting you up in this position, lifting up. When you think about a plump line symmetrically, left and right and left, you are really into the center of gravity, which means your whole biomechanics, your whole structure of your body is already at the level of Dantian. This is exactly where you will experience the dunamis power for your health integrity. So let's go and dive into the breathing. Folks, we need to engage our breathing mechanism. And the reason why you want to bring in the the breathing, and to exercise and to calibrate the rhythm of your breathing is very essential, because it will fire up the nervous system, your synapses of the brain. You will have critical thinking. You will have wonderful imagination. You will also have wonderful dreams. I assure you, this is power, folks, and we take it for granted. Like I said before, it's in a reverse order. We always want to eat food and drink whatever we want to drink, and not sleep very well, not being hydrated. But the most essential, the more, is breathing. When you have this quality of breathing, you are activating the mitochondria of the cellular component, and that is the fire, baby. That is the fire. The fire, when you breathe in the quality of your breath, with the meditation that I am healed, the meditation I am healthy, the meditation that no weapon is formed against, because you have the proper breath into your system. It's circulating into down to the cellular level, the molecular structure, into the nucleus and the cytoplasm. And let's focus now on the mitochondria. The mitochondria is the little organelle that, when oxygen permeates into that part of an apparatus, micro apparatus of the cellular level, it produces ATP. ATP is energy. ATP is a replication of cellular replication. Cellular replication, healthy cell. You got it? If these cells die, you're not replicating. If you are dying, your cellular is dying at a rate greater than your healing process, folks, you are aging quickly. You are aging with congestion. You are aging with toxicity. You are aging with inflammation, and inflammation is all about the process of being inflamed, of fire. You are in fire of toxicity. We got to minimize that. We got to overcome that. We got to have the power that you will make the proper technique to calibrate your physiology, so you could have these type of experiences of life. We want the best experiences of life. By the way, I want you to think about this, and this is what I think about all the time, especially me being a gymnast, and NCAA champions. Back in 1984, I would say that most of those experiences, the more I practice excellence, the more I'm able to perfect my quality of life. Yes, the more free throw you have, the more free throw you practice, you're going to have a higher percentage of putting the ball into the net. The more you practice the routine, the more you get engaged into, the more you give yourself an opportunity. This is my zone. This is my zone. This is my vertex to create my power, to regenerate my dunamis power. This is what we deserve. We want this. So to start off with, we're talking about 5, 5, 5, 5. Let's go through this very briefly. I want you to leave, you could sit up or you could stand up, but get back into the zone of balance. Down to the dantian. Dantian, 2 fingers below your umbilicus. And this is the area you want to touch. You really want to touch that. You want to get your brain to acknowledge the sensation of the dantian. This is where your vagal nerve is located. Dr. Jeff can talk about that. So anyway, 2 fingers below dantian, 2 fingers below your umbilicus. You want to place your tongue behind your teeth. Very softly, not hard. Soften up the tension of your face. Make yourself very, very beautiful to look upon. You want to breathe in through your nose and out through your mouth. In through your nose and out through your mouth. This is the exercise. This is what we want to focus on. I deal with a lot of athletes, and one of the major concerns is, Dr. Luyando, I want to breathe. I want to get the best out of my breath. Folks, if you're running 800 yards or 1600 yards or whatever it may be, or marathon, if you're not breathing properly, you will fatigue. You will crash. Your energy will crash. You're not going to get the best out of your energy. You need to breathe so you can maximize the glucose of your from your liver, the glucose into your blood, so you can maximize the best of your performances. This is your performance. This is your self-acclaim performance. I want my chi, my energy. I want to cultivate it. That's the gong, chi gong. Gong is to cultivate, to be disciplined of. It only takes discipline, focus, meditation, and the proper body behavior. Here we go. The first, when I say 5, is 5 seconds. That's what it is. 5 seconds. 5 seconds for time. Number 1 is tongue in position. Correct your body. I cannot overemphasize this. You want to go ahead and take a deep breath in, very softly. As you take a breathe in, you breathe in to a count of 5. So you go like this. As you're breathing in, you go. I like to go backwards, count backwards. 5, 4, 3, 2, 1. You hold your breath. When you hold your breath, again, 5 seconds backwards. 5, 4, 3, 2, 1. Then now you want to breathe out of your mouth very softly. And as you breathe out of your mouth, it's a 5-second sequence. 5, 4, 3, 2, 1. As you empty your lungs out, now you got another 5-second cycle. 5, 4, 3, 2, 1. So the pattern is this. As you breathing in, 5 seconds. As you're holding your breath with the volume of oxygen in your lungs, 5 seconds. As you breathe out very softly, not quite empty out all your air, just empty out just enough, 5 seconds descending. And then you got 5 seconds holding with no air, and then you repeat the cycle again. Let's do this in 2 cycles with all of us. Let's get focused. Let's get that dunamis. I want my dunamis. I want my power back. I want my self-proclaimed health back. Let's get this together. Ready? Sit up straight, tongue in position, dantian, 2 fingers below your umbilicus. Put your finger there so you can have some sensational of how the body's going to work and how deep you're going to breathe in. Ready? Take a deep breath in softly. Breathe out. Hold your breath. And just relax for 3 breathe. Just 3 breaths. Breathe in, breathe out, breathe in, breathe out, breathe in, breathe out. Let's go and recalibrate our power again. Let's do this one more round. Take a deep breath in. Breathe in 3 times, just normal breathing. Normal breathing. Folks, I assure you, please take this pearl of wisdom into the understanding, the knowledge that when you start practicing these type of calibration physiologically is taking place, correction is taking place, the fire of your health is elevating. You are being subject to really are be in the vitality of your graciousness of healing. This is what we want to be in. And this is where we want to appreciate the power, the dunamis power, and you deserve that. Every one of us deserve this. Folks, I have been doing this for 37 years within my practice, and all of my colleagues that end up retiring 25 years into the industry, have diabetes, high blood pressure, cholesterol level, various surgery, they're overweight. Folks, I'm staying as I'm practicing what I preach. This is what I participate in every time. Every morning I do this. When I'm in traffic, I'm doing it. When I'm getting engaged into a meeting like ourselves, you best believe that I was already into it. I guarantee you, when you do this, even before you have a meeting or even before you get into your family or friends, when you go through this, a minimum of 5 minutes, you will be so sharp. Your brain becomes so elusive. You will articulate and you're able to propagate the messages that is aspirational for each and all of us. Listen, thank you so much for tuning in. It's been such a grace that I was given this platform to participate and to provide each and all of us the pearl of such a wisdom at this very moment. Thank you so much. Jeff, are you in?
I'm here. I'm here. So, thank you. Great work. You know, I always tell my patients how powerful breathing is. I think it's something we take for granted, right? We don't really think about it because we do it constantly. But when we stop and put intention into our breathing, it does several things that I think are so important. And remember, wherever you are, whatever's happening in your life, you can breathe. You can stop and you can breathe. You can do this breath work anywhere. And what's so great about it, and what I really think is important that you emphasize too, is it demands your presence. It pulls you into the now, period. You can't not be present when you do this breath work, right? And then two, it physiologically soothes. I've literally put people on the blood pressure cuff and the pulse oximeter, and we've seen those blood pressures drop. Literally, I had a partner sitting there when one of my patients was doing this, and she was like, oh my gosh, his blood pressure dropped 40 points from doing deep breathing and breath work. And I love your thoughts about you could do it anywhere, anytime. You talk about doing it when we're in traffic and somebody cuts you off and you're stuck in a spot. You can breathe. You can breathe, right? When you're in freaking out and something's happening at work, you can go in the bathroom, sit on the toilet, or get somewhere you can sit and breathe. Do your breath work. It pulls you into the now. And the only place that our creativity and our love lives is in the now. So I think what you presented is really, really important. And so, yeah, it was very cool.
Dr. Jeff, really quickly, you mentioned something really good about reduce your blood pressure, and this is a secret about this too, because the part of the brain that is calibrating is the gauge. It is the gauge. It's a thermostat. Is really the medulla oblongata. The medulla oblongata is the midbrain. So when you activating it by your proper breathing, it lowers your blood pressure, your pulse rate, and also it brings the cycle of your breathing well calibrated to the point that you could feel the capillary of your blood into your fingertips and your toes. So
Yeah.
the medulla oblongata is the center of such a awareness. Thank you.
Yes, and it's so interesting because it truly physiologically soothes you. So a lot of us out there have past trauma, different things. So when you're triggered, when you're going through it, stop and breathe. It will physiologically soothe you. Men, we don't know how to really sit with our emotions, so we jump to anger. Our blood pressure goes crazy. Breathing, it will physiologically soothe all those things. And as you're working, it will kind of open up your body and your chi and your mind to healing. And that's what I think is so great about the work that you do with us, us who are lucky enough to be your patients, and work on the body work you do on us, but also the breath work you do with us. We always start with put your tongue into the roof of your mouth softly, start breathing, right? It's a part of everything you do with your patients. And I do much of this breath work with my patients as well. And that's why I really wanted you to come on and talk about how important breath work is for our overall health and certainly our sexual health too.
Thank you, Jeff, and thank you for the rest of the participants that are able to tune in and get this pearl of wisdom. I assure you, it will definitely transform your ability to to articulate the experiences of your life. You want to give that wonderful experiences to other people as well. Absolutely.
Yes. And so I got a couple questions. The first one
Yes, yes.
is it normal to feel emotional when I start doing breath work or pelvic awareness practices? What should I do with these feelings? I thought that was a great question because, yes, it is.
You know what? Absolutely. You know, there's a lot of exercise that we do. We have a lot within the container of our body, within our muscle, within our vital organs. We have traumas, hidden traumas. We have, toxin in different part of our heart, our spleen, our thyroid, our liver. No wonder liver is truly a number fourth disease in America,
Mm,
fatty liver syndrome. So no wonder. So when you go through these type of exercises, you are conquering the delivery of these toxins out of your system. So you all this stuff will surface. All this stuff will surface into a it will surface into emotional distress, and you got to stay on it. You got to continue to do it. You need to continue to work on it until you really articulate the better you. I would say it takes like 3 weeks. three
mm.
weeks to really feel the comfort without even thinking 5 seconds to engage into the calibration of your breathing.
Mm. Yeah, yeah, absolutely. And like I know you have seen too in my patients. Sometimes patients start crying when we're doing breath work because it brings up those emotions. It brings up those feelings. Because too, oftentimes we're mixing breath work with affirmations, about their worthiness and different things like that, or prayer or whatever. All that can be put into the breath work as well. And I often see patients who become weepy or emotional during those times, and that's okay. We can sit with those emotions. Our body, if you're releasing tears, your body needs to release tears. Let them go. It's a good thing. But you led into the very next question, and I think you answered it, which was how long does it usually take to notice benefits when someone starts working with breath and pelvic awareness work?
And the key factor when you start noticing some physiological changes, it goes like this. You're going to have better dreams. That's number one. When you start having more lucid dreams, and dreams that has meaning, by the way, not just fuzzy stuff. You will get up and you say, "My gosh, I remember the detail of that dream." That's when you know your physiological clock has been calibrated.
Mm.
And then also when you get up in the morning, you feel less stiffness. The stiffness of your body is less achy. It doesn't stiffen up as much. You have a little bounce in your swag. So this is where you're gonna start noticing the difference. You're gonna start noticing that you don't easily have mental fog. You're a lot more sharper, and you can articulate a lot more quicker. Another one is also a self-awareness. You become so grounded to your state of your mind, and also there's a sense of purpose. There's a purpose clarity, so much mental acuity that you're going to start noticing these physiological, wonderful, rewarding phenomena that is unfolding in your personal life.
Definitely. And so you start seeing those long-term benefits within weeks, but even the short-term benefits sometimes can be immediate. You can be like, wow, I feel completely different after that breath work. You've seen that in your patients, and I have in mine too. So short-term benefits can be very quickly seen, and long-term benefits can be seen. It's not going to take months. It's transforming and it's powerful. So it's really good. The final question I had was, how can couples use breathing together to deepen intimacy or improve communication during sex?
Oh my gosh, that is awesome, man. Oh my gosh, listen, or you're a man that is desired to have very healthy intimacy and the enrichment of the experiences of such a, not necessarily a climatic moment, because to have a climatic moment comes from different phases. Doesn't have to be a moment of ejaculation. And the one area is that you really you need to explore each other anatomy, the sensitivity of the anatomy of each other. You need to at least have your partner, your wife, or whatnot, to really, really be a major participant into exploring sensation that you have avoided or you have it's been suppressed. You want to tap into these neurons, these type of sensation that you need to engage. Now, when you engage, also breathing, you could breathe together the same way, breathing together, and also breathe reciprocal. Like as you breathe out, she or he breathes in, and vice
Mm,
versa. When you breathe in, that person is breathing out. So play
mm,
around with that. Play around
mm,
with that. And also the sound of breathing is very soothing. So when you get close proximity with each other and you having this cycle of breathing, your whole body become one in the intimacy of that moment. It's so beautiful to engage into these patterns. It's
mm.
very rewarding, folks, and we need to continue to explore those moments, not just because you want to. It's just you want to have love section, and then you get your sex afterward.
Yeah, absolutely. And even, you find a really comfortable position to cuddle in or spoon in where you can feel each other breathing, and you can sometimes you'll mirror each other's patterns. There's so many great ways you can do some breath work together. And you can face each other that way, but you can be body to body. There's so many ways that you could do that. And then sometimes that's so wonderful. You're not even going to be thinking about sex. You're like, this feels so darn good. Let's just lay here and do this, right? It cuddling and spooning it can be. So what's the goal? Connectedness and pleasure. Sometimes you'll have that just from doing that together. So I think all of it can be very rewarding and wonderful for a couple. And remember, what is more important to invest in than your self-health and self-care and your love relationship care? Those are two of the greatest things you could ever invest in that'll always pay off.
Absolutely, and I like the way you put it together. At first, I mean, let me say, sexual gratification doesn't have to be this type of climatic moment.
Mm-hmm.
And also, I would say definitely I have a lot of elderly people that they feel like a fire of desire for each other, and they ask me, they really have asked me, and again, we got to go back into what are you eating? Are you sleeping? Are you hydrated? Are you breathing? You understand these play a tremendous role. This is what my prelude discussion was all about. That we
Mm-hmm.
need to take that under consideration too, because your life and your health depends on these type of quality investment, and also the right people in your life, the right people that could inspire each other. We need to minimize the noises of the distractions. We need to be in the voices of justification, aspiration. We need to be around with the right quality people. I stay away from conversation that doesn't bring help, healing or affirmation to my state of well-being as well.
Mm-hmm. I think you're so right. What do we allow into this incredible brain of ours? Well, what are you watching? What are you hearing? What do you put into this wonderful body? How do you rest this body? Do you get proper rest? So important. We talk so much on the podcast about diet, exercise, healthy diet. It's not a diet, it's a healthy way of life. Exercise, sleep, breathing, all these things are so important to your overall health. I'm going to come back to you in just a minute. We're going to do a centering exercise for closing, and I'd like to see if you have one final message for our listeners as well. But I'm going to do a little centering exercise. You've already done some great breath work, but we're going to do a little centering exercise, and I'll be right back with you.
Thank you.
So, we have had such good breath work today. Before we close today's episode, I'd like to invite you into a brief centering practice. Something simple you can take with you into intimacy, into daily stress, or any moment you need to reconnect with this miraculous body that you're in. If you're able, place both your feet flat on the floor. Remember how Dr. Luyando taught you to put the tongue gently against the roof of your mouth. Let your shoulders soften. Take a slow breath in your nose for a count of 4 or 5. And let it fall out gently through your mouth. Now continue that breathing pattern about 5 counts in and 5 counts out. Bring your attention to the space between your pelvis as you breathe. The area between the sit bones, the perineum, the gentle bowl of the urogenital diaphragm. You don't need to tighten or hold. Just notice. As you're breathing, just notice that urogenital diaphragm. Imagine your breath reaching down towards that space as you inhale, like a soft wave rolling in and then rolling back out. Inhale. Feel the pelvic floor subtly rise or expand. Exhale. Feel it release and soften and settle. Let your breath and your pelvis move together for 2 more cycles. Easy, natural, without forcing. As you continue to breathe, offer yourself this grounded reminder. My breath connects me to my body. My breath connects me to my body. My breath connects me to my pleasure. My breath connects me to my pleasure. My breath connects me to the people I love. My breath connects me to the people I love. When you're ready, gently open your eyes if you've closed them, or return to your awareness to the room that's around you. Thank you for taking this moment for yourself and investing in you. And thank you for joining us. Now, Vic, can you tell us what's up? We kind of led into this a little bit with trauma and everything. What's up next week on Dr. Jeff Talks About Sex and Intimacy?
In this episode, Dr. Richmond shares evidence-based insights and practical strategies from her book, Reclaiming Pleasure. She offers survivors a compassionate roadmap for reconnecting with their sensual and sexual selves. You'll learn how to heal in ways that feel safe, empowering, and self-directed. You'll also see how trauma does not have to define your sexuality or limit your capacity for joy, intimacy, or connection. Whether you are a survivor, a partner, or a clinician, this episode offers straightforward guidance to build resilience, strengthen agency, and support holistic sexual well-being. Join us on December 9th at 7 p.m. Central Time to learn more.
I'm so excited to have Dr. Richmond join us. Her book is amazing. I use it with my patients all the time who've had sexual trauma, and so it's going to be a great episode. But tonight, thank you so much. Every time you enter my world and my space, you bring healing, and I truly, truly love you and appreciate you so, so much. Any final words for our listeners that you'd like to share as we finish up the podcast this evening?
Yes, Dr. Jeff and the rest of that are participating at this very moment, please, I would say for your ability to focus and to learn the basic anatomy, learn the basic physiology, learn the functionality that is given unto you for your greatest understanding. The more you understand, the more you carry this knowledge. With the prostate in the dome of the urogenital diaphragm, be mindful that you have an autonomic nervous system. You have the sympathetic nervous system and the parasympathetic nervous system. I'm not going to get too much involved with this, but those two elements, it really brings the fire of the healing process that you willing to endure and embrace. You also have the sacrum, dorsal nerve root. You have these wonderful, wonderful nerves that come out from the sacrum and also from the L5S1 region. I would say definitely chiropractically can help you to restructure these nerves that are exiting from, it comes down from the brain down the spinal cord and also exiting from these regions of the spine. Get these adjustments, get these massages to soften up the tension of the urogenital diaphragm or the girdle, the pelvic girdle. Soften them up. There was a moment back when I was an intern. I had this young doctor. He was a chiropractor, also 38 years old. I was very young. He would come to the clinic. He had a prostate massage. I don't know about the state of Illinois, but I would do this prostate massage on him, and it really helped him with sexuality. It helped him with urination, and it also helped him to really contain the inflammation of the prostate. And at 38 years old, you could just imagine he had an enlarged prostate. So these are other technique, whatever it takes for you to activate this autonomic nervous system, stimulate the structure of the spine, get these type of massages focusing on the pelvic girdle. And if the license permits, prostate massage can be essential as well. So these are other areas. Go ahead.
Yes, no, the lumbosacral area is so important to sexual function. So I'm glad you brought that up. Definitely. So many helpful things this evening. So listeners, you are miraculously and wonderfully made. You are so much more than any disease. Dr. Luyando has helped me learn and remind myself that labels are labels. They're not who you are. They don't define you. Your body is made for healing. It wants to heal itself. And so working with your doctors and different clinicians, but also working holistically on you is so important. I hope you know how beautiful you really are. Sometimes it's hard for us to remember that. Breathe into this moment because this moment has everything in it. Breath work is so important, and we thank you for joining us this evening or today or whatever day that you join us. So thank you so much and have a great one.